Here is your question. Right, so if you have read and understood, considering that history taking institution, can we begin?
Hello, I'm Dr. Muhammad, one of the exam surgery candidate. Today I have been asked to ask you some questions related to your condition. Are you okay with that?
Yes, doctor.
Thank you. May I confirm your name and age, please?
Yes, I'm Sarah, I'm 19 years old.
Nice to meet you, Sarah. So what's brought you here today?
I'm having abdominal pain, which is very, very severe. I cannot tolerate it anymore. Please help
I'm
me.
really okay. I'm really so sorry to hear that. Is there anything else?
Yes, doctor. I also am having loose motions, and it's very, very painful. I just can't tolerate my pain abdomen.
Okay, really sorry to hear that. So when did you first notice that?
It's since yesterday.
Okay, did it start suddenly or gradually?
It was suddenly.
Okay, can you point to the site of the pain, please?
It's actually it's in all my abdomen. It's not located in specific region.
Okay, can you describe the pain for me? It is cramping or colicky or stabbing in nature?
It's crampy or colicky pain, doctor.
Okay, does it go anywhere? Anywhere?
No.
Okay. Anything make the pain increase or decrease?
Yes, when I try to eat or drink water, it's very severe. It increases.
Okay. Does it come and go? How does it change recently?
It's constant, almost constant.
Okay. If you would rate the pain from 1 to 10, where 10 is the worst imaginable, how would you rate it?
It's 8, doctor.
8. Okay. How does it affect your day-to-day life?
Actually, doctor, I'm not able to do anything since this pain has started yesterday night. Not
Okay,
even my routine.
Okay, I'm so sorry for that. So, does it is relieved by eating food, fatty meal?
Yes, I cannot eat anything. It's just so nauseating. I feel so much of nausea.
Okay, does it improve by leaning forward?
Yes, a little bit.
Okay, did you feel any acid test in the back of your mouth?
No.
Is there any heartburn?
No, doctor.
Okay, did you throw out or vomit?
Yes, I just had one vomiting. It's maybe due to nausea.
Okay, is there any associated blood?
No, doctor.
Okay, does this pain go to your right shoulder?
No.
Okay, did you notice any yellow discoloration in your eyes?
No.
Okay, did you notice any blood in your stool?
No.
Okay, did you felt any chest pain?
No, doctor.
Okay, do you have any cardiac problem or you have investigated for any cardiac problem?
No.
Okay. Do you have any other chronic condition?
No, doctor.
Okay. Do you have taken long-term medication or you are allergic to any drugs?
No, I'm not allergic.
Okay.
No medication.
Is there any family history like this condition in your family?
No, no, doctor.
Okay. Can I ask you some personal question, please?
Yes.
What's your occupation?
I'm a student. I go to college.
Okay. Who is at your home with?
I stay with my parents.
Okay. Do you drink or smoke?
No, doctor.
Okay. Before I go further, what do you think is the cause?
Oh, I don't understand. It may be some infection in my stomach, but it's very, very painful.
Okay. What is your worst concern?
It's that I'm not able to do my day-to-day life, and I might have to undergo some surgery if it's not relieved.
Okay. And what do you expect us to do for you?
I just want you to examine and do some investigations to find the cause of this pain so that treatment can be started.
Okay. Yeah, so you said you have bowel motions. How many times per day?
2 times.
2 times. Okay. Is there an associated blood?
No, no, doctor.
Okay. Did you feel relief by bowel opening?
Yes, a little bit.
Okay. Did you feel have any unintentional weight loss?
No, doctor.
Okay.
Can you summarize our presential history now?
A 90 years old female presented with abdominal pain and diarrhea.
Yes.
About 2 weeks ago, no female received no significant past medical history and no family history.
Yes.
The pain is the associated nausea and vomited once time, and also she does not drink or smoke.
Yes. You can maybe tell me something about the character of the pain or where the pain is located and what are the associated.
Okay, it is generalized
Yes.
and colic in nature.
Yes. Any relieving or exacerbating factors?
No
Okay,
relieving.
so
or
what are the differential diagnoses that you will consider?
This might be acute cholecystitis, might be a peptic ulcer, or
Yes.
it can be inflammatory bowel disease,
Yes.
uninfective gastroenteritis,
How would you confirm your diagnosis?
and also maybe pancreatitis.
Yes. How would
After
you
taking
confirm?
history, I will do
Yes.
examination
Yes.
for abdomen and do rectal examinations.
Yes.
Also, I will do ROM investigation routines, CBC, urine electrolyte, and RFT. Also, I do abdomen ultrasound.
Yes. So what are the treatment options that you can offer her?
Okay, if it depends on the cause, if peptic, maybe conservative or medical treatment, PPI,
Yes.
or go for surgery, upper GI endoscopy with
Okay.
embolization.
Okay, thank you.
Thank you.
Can you give the feedback? It was very good, very structured, very systematic, and I think you were asking about the other part of the loose motion because one was pain and the second was loose motions. When
Yes.
time went. Dr. Snail, would you give the feedback?
Yes, ma'am. It was, ma'am, very nice, especially history of pain and all, very detailed.
Yes.
Only, ma'am, 2 points.
Yes.
When I said vomiting, then
Yes.
like, is it in detailed history of vomiting? Like, is it bilious,
Yes.
or is it how is it associated with pain, and what any
Yes.
intake of food like that?
Yeah.
And
And
Okay.
if there was any blood in the vomit as well, so that you could ask. Same goes for the
yes,
loose motions. Yes. Anything else you want
yes,
to add?
ma'am. Ma'am, and also she's a young lady, and
Yes.
also menstrual history and last
Yes. Very good.
date
Very
of
important.
menstruation was very important.
Yes.
ma'am.
Despite the fact that I've written that she's not sexually active, but still,
Yes, ma'am.
there was importance of menstrual history. Yes.
Yes,
Okay,
ma'am.
good. Anything else?
Also, ma'am, if like she might be in obstruction if she is having vomiting and colicky pain abdomen.
Yes.
So she's also having loose motion. So we
Yes.
can ask history of if she's passing flatus or not.
Flatus as well. Yes. And any foreign travel? No history was asked. Yes, Dr. Abbas.
Yes, ma'am.
Good evening.
Thank you, ma'am.
Yes,
Yes, good evening, ma'am. Sorry, I joined late.
that's okay. Yes.
I'm on a trip actually. I'm traveling, yes, ma'am. So I wanted to say, ma'am, that I feel, you know, when you ask the patient what's on from a count of 1 to 10, how severe, when you were trying to grade the severity of the pain, I think you should have when she told you 8,
Yes.
because there's always an examiner that marks your communication skill.
Yes. Yes.
It's important at this point to tell the patient, sorry, that must be really bad, because from 7 and above, that's severe pain.
That's
So when you get a score of 7 and above, you should offer the patient analgesics. So you tell the patient, oh, sorry about that. Would you like me to offer you some analgesics? Or you can bear the pain. Usually they'll tell you, no, don't worry. But as if the patient gives you that score of 7 and above, you should offer analgesics. That's just my contribution.
Yes, yes, that's a good point. Dr. Mohammed, you should learn that. Yes, and for me, if I say when you present history, that is very important. You were not writing down when she was the questions that you were asking, and she was telling you, you were not writing down. So when you had to present your history, presentation or that summary of 30 seconds is very important for me. So when I'm saying for me, for examiner, for you to pass, in order to pass the exam. So that's when examiner decides how much you can. You were asking very nicely, very structured, but then on presentations you were not writing down, or you were not paying attention. You could not sum it up and tell me. I had to give you a hint that you tell me about the description of the pain, where was it, and what type of pain was it.
So I will be offered a pen and paper in the exam.
Yeah, and then you can write it down. So then at the end, in 30 seconds, you have to sum up everything in a very nice structured manner, and then tell everything. That pain was all over, it was generalized, it was colicky in nature, it was associated with nausea and vomiting and loose motion, and exactly everything which patient has told you. You have to tell all the positive points, all the positive findings. So that is very important for me. Rest, it was all good. Thank you.
Thank you.
Yes, Dr. Kama, you raised hand. Yes.
I don't know. Did he ask about fever, ma'am?
Yes.
Okay. Yes. And can we mention cardiac history? Like he said, I was asking any history of cardiac disease or something.
Young patient and no family history.
No, I mean like cardiac.
Dissection, you mean, or something? I don't know. Those
we
things
could say heart
yeah.
disease, no?
Instead of asking like this, is there
I think
condition?
If it is a big.
Yes, please.
If it is pain in the epigastric area, we should ask about the cardiac symptoms.
Okay, you can ask.
MI.
Yes. Yes.
No, the word.
But yes, but the patient in this case was young, so might not be correct? I don't know. If it is all patients, I think we should ask.
Doesn't matter if it's even if it's the young patient. Sometimes patient has been born and they didn't know they could have a unfused ventricular wall, or they could have ASD or VSD, and then when they are young and they are doing exercises or they are doing sports, then they are suddenly developing symptoms, and all of a sudden it can happen that they are adult or they are young youth, and then they are first time presenting with symptom when they were born with VSD or ASD. ASD more common in old people, but VSD. So it can happen. So yes, Dr. Karma's question has some point that you can ask. But once, since you asked where is the pain located and patient told you generalized all over the tummy, then I think it is unlikely, but still can happen, because VSD pain is retrosternal more kind of, yeah, but then it can, patient can explain it in any language. It can, yeah, even be like chest pain. Depends. Very good, nice question. Yeah.
Yes, ma'am, may I ask one question, please?
Yes, please.
Ma'am, in differential diagnosis, can we say acute mesenteric ischemia or something like that?
Yeah, with 8, pain as great as 8, yes, you can. Any abdominal condition you can mention, but then only you have to think or keep in your mind the order. The number one that you are telling, that you have to justify number one. Whatever you are adding at the end, don't play much role. But then you can definitely, because that also kind of has this sort of thing.
Yes, ma'am, sure.
Yes. Good.
Okay, ma'am, thank you.
Good. Thank you.